Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And today's guest is Joe Diver. He's Chief Information Officer at the Valley Health Systems. Welcome, Joe.
Hey, thanks, John. Appreciate it.
Yeah, excited to learn from you and about your experience. And it's the hottest topic in healthcare IT, I think, right now. Most of our conversation about AI. But before we go there, tell us a little bit about yourself and Valley Health System.
Sure. I've been in this crazy health IT space for 25 plus years.
Wow.
Started way back when as an educator for one of the EMR systems and
Okay.
product management, and found my way to the CIO seat back in 2004. And from there, a couple of other stints as a CIO, and then went on the vendor space, and then into the innovation area. Last 5 years leading innovation at Bay State Health, a $4 billion health system right up the road. And more recently joined Valley Health, which is made up of Holyoke Medical Center, Holyoke Medical Group, VNA, River Valley Counseling, and over 300 physicians. So it's much more on the smaller community side, but we have about 500,000 consumers or patients in our region. And the reason why I joined in Valley Health is really specifically around the digital strategy, digital front door, digital innovation, and staying ahead of the curve so they can survive and thrive as an independent community organization. And with 80% Medicare and Medicaid payer mix, it's a desperate need here to make sure we can continue with the high quality care and reduce costs within the community. So it was a great opportunity, and been here for, I think, almost 90 days. But walked into a great organization with a great project because they were awarded a almost $1 million grant from Blue Cross Blue Shield, specifically around health equity.
Okay.
So it's all about digital innovation and engaging the consumers, and also our care team members a little bit differently. So pretty excited for that journey.
Yeah, that's fascinating. Well, I love that you've gotten the investment. That's always a nice thing. But what an interesting broad perspective. With that in mind, talk about what are some of the most exciting things in digital health that you're working on today. Whether it's at your current organization or even maybe some in your past organizations.
Sure. Yeah. It's one of the things that from a digital innovation perspective that I always look at is really what problem or what passion problem we need to solve, and then look for the right solutions to solve those problems. And one of the, I think, more recent exciting stories I can share with you, John, and the audience, is around OB. So moms that are high risk of preeclampsia. One of the physicians brought this issue to me, and she saw some interest in solutions in the market. At the time, we were filling out an FCC grant, and I kind of stuck it in there because the funding is the first thing. If you can't get the funding, how do you move these? Everybody needs to align the economics. But I'll keep the story short. Because of this program, she was able to monitor two specific moms that were high risk and on a clinical path for early delivery and NICU stays for the babies. Both moms went full term. And once that story got out there, then one of the payers leaned in and said, how do we do this for our members? Because you can think of a NICU stay and that cost. Sure. And another exciting program was around asthma, bringing a digital tool to patients that could, again, remote monitor from home and different things of that nature, alert the triggers. One of the patients was quite excited when she got that call. And she thought she was going to have to go to urgent care ED, and they actually did some things remotely and helped her through it. And there's a video testimonial of her saying that it saved her life. That's how she, as a patient, as a consumer, interpreted that particular engagement. So the opportunity is there, and how do we do more of this, and how do we figure out the economic alignment with that as well, as we kind of drive those forward. But it's really, my colleagues on the clinical side, operational side, leading in with the problems that they're trying to solve, the challenges that they have, and then just continue just to think a little bit broader and more detail around that, and how do we figure that out, right? So those just a couple of stories more recently, and I'm excited about the path that we're on here at Holyoke, as we're leveraging some of the technology that we're deploying, actually goes live next week, is around remote engagement with the patient about before they come into the hospital, and help us capture this information and know more about the patient. So it's the SDOH, it's the SOGI, it's the REL data, right? And then capture that data, then how do we then transform the way that we engage with patients. If we know, everybody's trying to figure out the same issue. If a patient has a transportation issue, how do you solve that problem? And how do you solve that for a community hospital that's 80% government pay? If we can survive and thrive off that 1% margin, 1.5, or stretch it to 2, we're going to do okay. But we have those big challenges in how do we create these programs and begin to know more about our patient, transform the way we engage with the patient and our clinical teams, and then drive it forward. So we have a pretty broad vision here at Holyoke, which was one of the main points of interest in joining the organization. And our CEO and our board, they're going to stay independent. So we're in the shadows of academics.
A lot of giants.
Exactly. We say we're in the shadows, but we have our own sunshine at the end of the day, right?
So that's nice.
Yeah.
I like that.
Yeah.
Well, and I think it is interesting. You talk about aligning the financial stuff. I mean, to me, the other question is how do you scale to the problem, right? And one of the answers for me is AI. But I'd love to hear how you are thinking, or how are you looking at and kind of approaching AI, and of course, I have to mention ChatGPT, which has become the sexiest AI to hit the world, not just healthcare. So how are you looking at it, approaching this AI and ChatGPT like solutions?
It's a big and complex question at the end of the day, right? And one of the things I started to do is as an innovator, I love to do gut checks. I love to kind of get in front of a group and say, what if, or what do we think, or how do we leverage this? And it actually recently came up in a compliance meeting. Our compliance officer was concerned because some of the risk that she's seeing out there in the market, and some of the stories she's seeing from a healthcare perspective. And she was asking me, well, what if we just turn it off, right? Not be able to access it from our systems. And I brought that to our med exec committee, kind of a gut check. I said, hey, what are you all thinking about this? And 2 of our providers leaned in and said, no, we want to do more. We want to learn more about this technology and how do we apply it within the framework of what we do as physicians, and whether it be from a research perspective. And they see the power of it. And it's like, okay, now as a CIO, I need to figure out now, how do I put the right guardrails up and protect the organization from any risk, risk,
PHI risk,
risk, or just interpretation of what they're receiving back from that GPT inquiry, and how do we then build that into the EMR process and the workflow. So very early on, but we're starting to have the conversation because we can't ignore it. We have to figure out, how do we adopt it, how do we leverage it, how do we possibly use it for physician satisfaction, reduce physician burnout, and how do we help ourselves, automate more of our systems using that technology under the hood, and looking at AI and ChatGPT. Funny thing, John, when I began to think about this, I went into ChatGPT. I said, give me a nice, a warm morning message for my 17-year-old daughter that I can text her in the morning. And I gave this beautiful little thing for a text, and I sent it to her. And she's like, "Oh, that's sweet, Dad." I'm like, I had to fess up, right? It wasn't me. It was this automation, right? So in one of our physicians was looking at try and do some research on a hypothermia protocol, and he said, "Well, let me just put this in a GPT," and 15 seconds later, it came back to him, and he's like, it was pretty darn accurate at the end of the day. Yeah. So what we're doing, John, internally, is that around with the Med Exec Committee, we're bringing in a CME program. So we begin to look at it, begin to think about collectively and kind of an academic approach to it, and what is it in the market that we can leverage this technology for? What should be our strategy or our process? What should be our governance framework? I think there's a lot of organizations that are in the same boat at the moment. Yep. And then collectively, how do we kind of bring this forward? And just yesterday, I was on the CIO council related to within Massachusetts or the New England region, and that's the topic that came up. So we're going to start diving into it as CIOs collectively and say, okay, how do we apply this within our 4 walls of our organization? How do we learn from each other? Then kind of looking outside and looking at what the market's doing. I begin to think about, how do vendor partners now apply this within their applications?
Yeah, I was thinking the same.
Take on that ownership of, okay, how do they leverage it to make their platforms or their programs much more valuable and richer, and help us streamline workflows and practices. and things of that nature. So, but very early on, but it's a very good academic conversation at this point, but something we can't avoid, and we have to figure out the guardrails of how we apply it.
Yeah, I just got back from Boston near you, at an EHR user event, and they demoed a dozen or so, Chat GPT like or inspired, features. They aren't using Chat GPT; they're using a private, solution, of course, to protect PHI. But yeah, I mean, it's coming through the vendors. And even moving beyond just ChatGPT, although it's interesting those examples you offered and the doctors wanting to use it. That's an interesting perspective. And how do we put the guardrails that make sense? Are there areas that you can kind of see early on from these discussions where you think, hey, AI and ChatGPT are going to have an impact, and maybe some areas where you're like, yeah, I don't see it going this direction and really impacting this part of care?
Yeah, I think there's a couple of different, and if I was to make a short like top three list, I was just kind of thinking about this a couple of weeks ago.
Uh-huh.
Where would the value be? And it's like we all know the challenge of new research and understanding new medical practices and best practices. How do we access that for providers if they have a difficult case and kind of like a patient like me, and how do they know which medications or things to think about? So that aspect is one. And the other is if I have a patient that is having some sort of conditions, what's the family history of it? How can I quickly scan the records of not only within the local health system, but wherever their relatives are? How do I make those connections? That's another. And generally just improving the way we take improve the physician workflow or the clinician workflow within all these different tools and applications that we're leveraging. We know that AI has been quite successful in the radiology space for the last number of years. And how do we think about the same kind of stuff within our hospitalists who get to see the patient when they get admitted and need to know a lot of information about the patient pretty quickly to help with the care plan and care treatment process, and go from there. And how can we leverage these technologies to maybe even get it more advanced to the home and things of that nature, when helping the patient either recover at home or hospital at home, and connect all these different data points together, and automate alerts more, in a better workflow perspective. And then the last thing I always put on my list is, how can we afford this as a community hospital? Back to the 80% Medicare and Medicaid. And I think it's going to be a direct correlation to that value-based care strategy. If I can reduce costs in the healthcare ecosystem and improve quality, leveraging this technology, that's a win-win-win. Because I'm certainly not going to get the $200,000, $300,000, $500,000 annual SaaS model spend for an organization like Valley Health. So those are things that I kind of think longer term about.
And what's sad to think about is how can you survive without it, right? When you look at some of the summarization capabilities, the language capabilities that are likely needed by your populations, that's going to really bridge that health equity gap, right? As far as, hey, can you write this at a second grade level so that they understand it, so that they can actually process it? Or can you translate it to Spanish so that they can read it in their native language and understand what you're trying to say? It's a tough one. It's like, how can you afford it, but how can you afford not to do it, right?
Those other high valuable use cases, John, for sure. There was a case that another organization was at a number of years ago, but the discharge instructions were translated, but there was like a special instruction in the middle that wasn't translated, but it was very, very important for the patient to understand it. So that ended up with a patient that didn't follow the process and ended up coming back as a readmission because she missed that part, and she didn't have a caregiver or a loved one that saw that, so she was on her own. So you think of those use cases and you say, how can we fix that? What was missed, or what technologies can we use to translate this stuff across the board and help the patients? But
yeah. I mean, I saw an incredible technology at HIMSS. Lexmark scanned in a document and spit it out in another language. Like, fascinating,
That's
right?
awesome. That's awesome.
Like
Yeah.
it's amazing what to do, but you're right. There are risks, so we have to
Yeah.
make sure we test and vet it. How about retail health and big tech? Do you kind of see them as a threat, or are you doing anything to kind of adapt to their entrance into healthcare?
It's another great question. This was pre-COVID, and we had a community forum in Springfield, Massachusetts. There had to be about 200 people at this community forum, and I asked the question of who do you trust with your healthcare data? Google, no hands went up. Amazon, no hands went up. CVS, a couple. Walmart, a couple. How about your local health system? Majority of the hands went up. All right.
Mm-hmm.
So how do we then compete against these others that are creating a new consumer experience? I think it's just that philosophical change. For example, we're about to launch it opens up in 2 weeks, a retail pharmacy for a community hospital right down that lobby. Meds to beds program, but now we start talking about how can we do home deliveries for a small community hospital, but the value and the economic alignment makes sense, right? So that's how we need to compete against those others, is to engage the patients and keep them within that ecosystem. I, for one, have tried some of the virtual care options to learn more about it. I find it interesting. I love the flexibility. I enjoyed it. With the majority of our community members, maybe not, but we'll into the inner cities, absolutely. I mean, there's going to be that kind of competition along the way. So not much of a local threat for us, but certainly what I see right over the border with Hartford Health System, what they're doing with One Medical and with Amazon and with Google. Those are the threats that I'm looking at now. It's like the health systems that are leveraging those ecosystems and bring them together. What does that mean? Although they're right over the border, they're only about a half hour away from us. So you got Holyoke Medical Center, Bay State and Springfield, and a little bit further south is Hartford Healthcare, under the leadership of my good friend Joel Venko, who I know
Yep,
you know. Joel,
I know
great
Joe.
guy. Yeah. So I'm watching him closely, right? So, but I think that's more of a threat for our region than the big tech plays.
Interesting.
But certainly watching those big tech plays and understanding the value and then saying, how can I apply that same kind of thinking or process locally? I think it will help us in the long run for sure.
Yeah, and I think it's almost the wrong question around, do you trust the Google with your data? Because you got the obvious outcome, right? Of course we don't, right? Yeah. But the interesting thing is if you compound that question, right? And this happens in sales process all the time. You have to compound the question for the salesperson to give you the right answer.
That's right. That's
like
right.
if you compound it and say, do you trust them with the data if I give you a convenient experience?
That's right.
Then it turns out in most cases, convenience trumps the fear of data loss, which is a fascinating thing, right?
That's all why we press I agree with the new Apple update, not read anything about it, right? So,
You understand, right? Like
that's
so
right.
it is interesting. Like convenience is such a tough competitor, right? But
That's right.
a lot to figure out there for sure.
That's exactly you hit the spot, you hit the nail on the head, John. That's exactly the thing. Is like, how do we make it more convenient for our consumers, our patients within our small community, to take that friction out of the equation, just like the big tech plays are. But you're spot on. Yeah.
Yeah, but you're right. If you do make it convenient for them, they do trust you more, right?
Yeah.
Like so, which is obvious. But so I think that's where it's going to become a bit of a haves and have nots. If you don't make it convenient, then they will eat your lunch. But if you do, then yeah, you'll be fine. So it's interesting. How do you look at innovation in your organization, and now you're leading innovation in your organization? Do you have a process that you use for kind of discovering the latest innovations? Because I think it's a challenge for many CIOs who listen, that like they're so overwhelmed with the minutia of the operations. What's your process for leading innovation and discovering innovation?
The key is that we make it part of our culture. We carve out time. So when I was going through my interview process, the one question I asked here at Holyoke is, how much time do you spend in the run or the maintenance bucket? How much do you spend in the new product and new implementations, a new program bucket? How much do you spend in the innovation? And innovation was zero. And I said, well, let's talk about the value of the innovation of how we can build efficiencies. So the first thing is to build it into the IT team culture, and then make sure the senior leadership is also on board. And this is, I'll give credit to Joel Venko. He taught me the importance of a prospectus of what's going on in the market, share the ideas, tell the stories. And we just started doing that. And when those stories solve a problem, there's a kind of a pull or a connection on that. So one of the recent stories I shared was back to the remote for asthma patients in pulmonology. And immediately a physician and a practice director said, yes, we have that problem, because on our strategic whiteboard is reduce the ED visits for this group and reach out to the rural part of the market and things of that nature. So sharing those stories begins to create the conversation. And then when it comes back in, we look at our IT slotting process and we carve out some of our time for innovation delivery and program delivery, if you will. So that's the key is the culture aspect of it, and then build it into the model, because we can make more, we can achieve more value, I believe, by innovative models than we do just standard IT stuff, right? And the really interesting thing, John, is that in my staff, I have a great group of team members. In my ambulatory group specifically, I have 4 younger folks who came over from ambulatory, and they're not IT analysts. They came over because of an implementation, and they stuck here. And so I sat them down, because this new program we're delivering is all about ambulatory. It's all about the patient engagement. And one of the key members there, her role is just training, going out and training people. I'm like, well, think differently, think differently, think differently. She's already brought 3 great ideas to this program that's changed the way we're looking at delivery. So even just an innovative mindset of trying to bring it together and letting people engage and make those suggestions or those ideas and experiment with them. So we're not going to solve the world in one day, but we go to experimentation, look at what the impact is, then begin to scale. And if we look at ideas, we might have ideas in our Horizon 1 bucket, and we might have other ideas in our Horizon 2 and Horizon 3. And right now, in this particular product, we're on Horizon 9 bucket, that we're kind of these containers so we can execute and scale. It's almost like sprints, but without calling them sprints or things of that nature. But the key aspect initially is culture change. And almost at day 90, and everybody's bought into it. So again, we're more nimble because of the smaller community size, but the same type of ideas can apply. But you really have to, I would suggest tell the CIOs and the leaders just to make sure you make time and build it into your culture of your organization, from CEO all the way through. So
yeah.
So far, so
well, and
good.
I feel like most people want to be innovative, but
They do.
if they haven't been enabled to, right, then they're like, well, if they're not heard, then they don't do it. So that's interesting.
And on that OB story I mentioned earlier at the top, is that we started with 50 patients. And by the time I moved on to the next organization, there were up to 1,800 patients on the program. So the scale and the process and the physician buy-in from that one physician now went to 2, then went to 8, then went to 10. Right. So it's like, how can you, experiment, scale, experiment, learn, and scale, and make sure we're making the right investments and watching that return? Because we can look at experience for the physician, we can look at experience for the patient, but at the end of the day, we really impact in the clinical outcomes, the quality outcomes, and the cost savings, and follow the economics. Because if it's not impacting the needle, then what are we doing, right? At the end of the day, whatever that needle might be. But although experience is important, it doesn't drive the cost savings completely. All right. So,
for sure.
Yeah.
So it's interesting to think about your horizons and working on Horizon 9. Is there a big challenge right now that you haven't maybe quite figured out a solution to? And, obviously we have a lot of listeners, maybe they'll reach out with some solutions. Is there something that you're like, I'm trying to get my head around this, or, or a challenge you face that you're like, I'm working on this one?
That's a great question. The challenge that I have in front of me now is just thinking about the consumer journey and the digital front door, and what technologies will this community really adopt and lean into, right? So, and every organization is quite different in that space. So we will survive or die in the vine based upon how we retain patients, how we decrease the leakage from our organization. So that is a top priority for me, is how do how do I wrap things around that from a digital enablement to minimize that happening? And that challenge then goes from a technology perspective to an operational perspective. How do I make sure that the operational folks are actually leveraging those? And so this is, I think, I've learned over the years, I can deliver technology and deliver programs, and then 8, 10, 12 months later, there's a problem because on the operational side, whether it be changes or something else going on, need to get more into not into the weeds, but at the higher level analytics and making sure these programs are moving through. So the number one challenge I have now, which is an opportunity in my mind, is taking our project management, well, first the digital front door, but more importantly, taking our project management mindset and moving into a program management mindset that we're not going to leave the program. We're going to make sure that we get the results and the impact that we desire. But that's also a little bit of a culture shift, because it's just taking things different from on the collaboration from the operational side and the IT side. But consumerism is one, minimize the leakage is two, and then how do we transform the way we look at the programs to make sure we're tracking those correctly. So
yeah,
I hope that's helpful.
Great. Love it. I think that's a really interesting framework to think about, the challenges you face. Well, we always like to wrap up with a bit of career discussion, career advice, career experience. So, as we wrap up, what's the best piece of career advice that you've been given or maybe even learned in your career?
Yeah, if you have an idea, put it on the table. It's not the title that wins, it's the idea that's going to make the improvement. I learned that a long time ago. And it's stuck with me forever. And the story behind that, John, is I was a young project manager and worked for HCA out in Nashville, and worked on implementation down in Florida. And I had to deliver a challenge and message to a local administrator down in Florida. And I met with some folks in HCA. And my boss said, just put it on the table. It is what it is, right? And that just actually flourished to something different and improved the implementation and whatnot. So always have the willingness to put it on the table. That's why I tell my team when we get into our into our team meetings or the division meeting, it's not the title that wins the idea, it's the idea that wins at the end of the day. So, and those just get on the table and you have conversations, so don't hesitate.
Yeah. I love that. Be brave. It's
brave,
I think that the most exciting things happen when you're brave and you throw it out there, right? And
that's right.
That's right. I think it's an interesting discussion though, right? Because obviously I love the idea of putting it out there, but I think some people are like, wait, so I need to be rude, I need to be forceful. And it's like, no, you can balance the two, right? You can do it in a way that's thoughtful, but is brave that your idea could be rejected, right?
and most of the time I begin those ideas or put them on the table with the what if we did this, or what if we thought about it this way, or what if we step back and rethink the approach a little bit, and then as you kind of think through that and analyze that, then you get to the why not do it this way, why not why not implement that. So so it's quite interesting, but that's what I thrive off, is when my team and others in the organization do that. And I'll leave you with this other thing is is to partner with the operational leaders, that they're actually talking about some of the terms. So in this particular program, I'm calling it a digital front door, a first step into the digital front door. Everyone else was calling it kiosk and mobile this and mobile that. I'm like, it's digital front. And we start talking about the language, right, that we use. Because, and then when you have the operational leader who's explaining this program to the CEO or to the board as a CIO, I'm sitting back drinking my coffee and just listening to the conversation go. It's phenomenal when that kind of begins to evolve. So, but so that bravery goes all the way from to the top, all the way to the frontline employee to bring those ideas forward. So
absolutely. Well, Joe, this was a enlightening discussion, exciting times. Love all the work you're doing, and excited to see, how you impact Valley Health System. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting application. Thanks, Joe.
Thank you, John. This was wonderful. Appreciate your time.